I'm going to turn the session over to our presenter, Dr. Suzanne Anderson. We are very proud and happy for her to be here today. Dr. Suzanne Anderson is a former NOVA staff member, of which we are very thrilled, and we're happy to be having this partnership with her again. And we will continue to do that as this unfolds. She's a certified NOVA crisis responder and has been a NOVA CRT trainer and crisis responder in Singapore for over 20 years. Dr. Anderson also led the crisis response teams that supported the Jakarta Intercultural School in 2014. So I turn it over to you. Thanks, Dr. Anderson.
Thank you, Roger. It's good to be here. Good morning, good evening to those of you, depending on where you are in the world. I wish that I could see all of your faces. I've sent some of you as you were coming into the room a chat to say hello. But I'm glad for this technology that allows us to connect people from 22 different countries, 30 countries altogether between the two webinars that we've done. And we've had people from Asia and Pacific, from Central America, South America, Europe, and the Middle East. Today's session, we're going to be focusing on the crisis reaction. And I'm so glad that you can be here because sociologist Dr. Strong talked about two epidemics. He talked about the epidemic of disease, and he talked about the epidemic of panic, which I really want to expand to be really the epidemic of emotions that can be part of this experience. And I had an administrator in Shanghai, as we were putting out the information for this talk, say, you know, we're pretty distracted here. And from our first presentation last week, we learned that a lot of the international school educators are feeling overlooked, that there's a lot of energy being put into taking care of students and taking care of students' families. And that doesn't leave a lot more time for self-care for educators. And so I'm glad that you've taken this time for yourself. After talking about kind of our crisis reactions that we have in response to a critical incident like this pandemic, and some of the longer term stress implications, we're going to turn our attention to looking at resilience and coping. What are some of the ways that we can strengthen ourselves during this time? We'll follow up with some resources that we hope you find of use. And as Roger said, we'll have some time for question and answer at the end. In our day-to-day life, we live in a place of positive stress and negative stress. And as you see the thick lines at the top and the bottom, that stress falls within a natural range, a range that we're accustomed to dealing with or that we can manage, in which there are people around us who have experienced similar things and they can help us. It might be a sick child. It might be supporting elderly parents from a distance, living overseas, work challenges, dealing with angry parents of a student, but all things that are in some way routine, even though they can also be stressful. But when trauma happens or a crisis happens, our equilibrium is taken outside of the range of what we normally humanly experience. And those stressors can be acute or they can be chronic. And I'm going to be comparing these two kind of throughout this conversation. When we think of an acute disaster, we're looking at something that's time limited, like an earthquake. It comes pretty quickly and we move into recovery. And then we can have chronic stressors. And typically we have looked at elder abuse and domestic violence. But this is certainly where this pandemic falls. I think in watching how this pandemic has moved across the world and sitting in Singapore, watching that happen, talking to educators in Chengdu and Shanghai, it's felt to me like this disaster or this crisis has kind of creeped in. It's creeped in on waves. And what I mean is that the impact of it, when we start to realize that it's something that's affecting and changing our lives, can be so different for many of us. For some, it could be the school closing, and for others, that might not be the impact. For some, it might be the spread of it where people they know live and they start to realize that it could affect somebody that they care about. And it's felt to me like a weighted blanket that we're all trying to live with our normal stress, the blue line on the screen. And now we've moved to having this red line, the one that goes outside of our range. And it's like wearing a weighted blanket that we have to move around in our daily lives. And that's quite a heavy thing to be carrying around. So we have a natural human response to trauma. It follows similar patterns between people. The interesting thing about it is that many people, as they're going through it and they put on their social face, so they're not showing other people's their internal reaction, they start to feel isolated because they think everybody else is not feeling the same things that they are. And sometimes they start to feel like they're going crazy because they're having strong emotional reactions, but they're not seeing it in other people. And so one of the benefits of having these conversations is that we can talk about that natural human response, and we can put some order to the chaos that we're experiencing individually. This natural pattern includes emotional, physical, and behavioral reactions. And as individuals, we may experience only some parts of this reaction, or we may experience all of them. And the reality is that we don't experience them in a linear pattern. And sometimes it feels more like a pinball, or for those of you that are familiar with pachinko machines in Japan, it's just one of those little metal balls that seems to spastically bounce all over the place. Sometimes that's how people experience it. And it's not unusual for us to experience these reactions in waves, where we're feeling them strongly and then we settle into a new equilibrium, and then something new happens and the wave comes on and we experience it. Or to experience these crisis reactions in response to cues or triggers that happen at a later time. So I'm going to look at this from starting at the emotional reaction. In COVID-19, we noticed that our emotional reactions might start with shock, denial, and disbelief. There's a sense of, this is impossible, it's surreal. How could something blanket and start to blanket the entire world? We may move to having a feeling of regression, where we're not sure how to make decisions. Our mind feels like it's pushing itself through cement, and we're trying to make decisions about things that there's no blueprint for. There's no other person to go and say, hey, how have you gotten through a pandemic in the past? What should I know and what should I do? And often in this initial reaction that we have, we take actions on how to survive. And in fact, our old brain, the little piece of the brain that is like the lizard or the zebra, is making assessments. It says, safe, am I safe, not safe, safe, not safe. And often we quickly make decisions without using the new brain, the part of our brain that can analyze and compare. And then we go back later on and we say, why did I do that? Or our friends and relatives say, why did you do that? And it's not a fair judgment because it's two different parts of our brain that are responding to that. Often people experience a kind of cataclysm or a roller coaster of emotion. Starting off with a sense of fear. For some people, they call it a sense of terror. We can be afraid of snakes, we can be afraid of heights or geckos or monitor lizards, but this is a different kind of fear. This is a fear that we describe as having the veil of immortality having been torn away. Will I get the disease? Will somebody I know get the disease? I read a humorous comment the other day where somebody said, I've had the virus 6 times already. As we sit there and monitor ourselves, sometimes if we get a sniffle or a cold, we start to catastrophize that we already have it. And certainly as we see the panic and anxiety that many people are having, this is that fear and terror. And it's not just of the unseen that's out there. Sometimes it comes home to us when we cough or sneeze, or when somebody around us, too close to us, coughs or sneezes. I remember my own very strong reaction when I was on our public transportation here, and there was a young girl wearing a mask, and she pulled it down just so that she could put her hand over her mouth to cough and sneeze. And I had to acknowledge my own sense of fear as that was happening. Often we can have an experience of anger, but it's sometimes not just simple anger that we might have when some of our family members leave socks on the floor, or leaves the aircon on when they're not supposed to, or hasn't turned off the lights, or didn't close the refrigerator. It is an anger that is larger, that some people would describe as fury or outrage. And in this crisis, I look out there and I say, who do we want to be angry at? You know, when we have a criminal activity that happens in a community, we know who to get angry at. In this situation, the disease, the virus, that awful little cell that we see pictures of with all the little spiky things sticking out, you know, how do we get angry at that? And so often I think that this anger, this fury and outrage gets expressed at the people that are closest to us, to family members. And I think actually a lot of times employers right now, and I think that employers, we have this old saying, don't shoot the messenger. And I think for many of us, our employers are the messenger. Governments come up with new guidelines and stipulations that have to be carried out, and employers have to interpret that, and employers' decisions, some have been good, some haven't been so good, but they materially affect our lives, and they materially affect our future and the lives as educators of often our children who are with us, and the children that we're teaching. And so we often can take that anger out when in fact it's really about the danger that we're feeling. It's just that that danger for the most part is really unseen. We may have a feeling every time we go through something that seems sudden, random, and arbitrary in our lives, we try and make sense out of it. In fact, we live our lives as a story, as a narrative. You know, I can tell you how I ended up in Singapore. I can tell you that we came for 2 years and that now we're here for 20, and why we've stayed. But when crisis happens, we don't have a story and a way to put it into that narrative. And so we start working on it. Well, how did this happen? And why did this happen to me? And we can also start looking for information on how to be safe, or how to take care of ourselves, or where we can travel and where we can't travel. And unfortunately, there is not enough information quick enough, or that information is changing by the hour or by the half day. And many of the plans that we make in our lives, whether it's plane tickets or the next holiday or home leave during the summer, we don't make those hourly or daily. We make those sometimes 6, 9, 12 months in advance. And so all of this has come down and created a real change to the predictability of our lives. I know that this started off very confusingly for many people in China, because educators were leaving school and administrators were gone from school for the Chinese Lunar New Year, and that it was difficult to figure out how to respond or what the school was going to expect, and how we were going to cope with it. There can be guilt and self-blame, and as we try to put together a story in the confusion and frustration, sometimes we don't have any answers. And when we don't have those answers, we might start to blame ourselves and say, I should have known, if only I had done this. We might even ask ourselves, why did we go overseas? And for many of us, we may even have, you know, the voices of our parents or our siblings or our loved ones who have asked us a number of times over the years, why are you going overseas? Why are you leaving us? And if somehow in that guilt and self-blame, now guilt and self-blame can be irrational or rational. Sometimes if we're careless, we might do things that endanger ourselves more. But most of the time when we feeling guilty or blaming ourselves, it's irrational. We're doing it with hindsight. We've learned something now that we didn't know then, and we think we should have made a different decision with that hindsight. But if we judge ourselves as having failed to protect ourselves in some way, we can feel shame and humiliation for not being able to manage ourselves or our children or our lives better. Truth is that also sometimes the details of our private lives become public when crisis happens. The status of our relationships, maybe our financial situation is not as ideal as we would like it to be. For some people that I spoke with, they've been living indefinitely in the spare rooms or the couches of family and relatives back in their home country, and feeling the frustration and of not being able to manage their own life, to have their own place, and feel that somewhat as a sense of shame and humiliation. And then we move to grief and sorrows. So when we look at a crisis, we say there's a reaction to the crisis, and then we look at all of our losses. Those losses may be physical losses or material losses or intangible losses. And there's a process of grieving each of those losses that has its own process of denial and bargaining and anger and sadness before we can move to some place of acceptance. And in talking to people, some of the losses that I've been hearing about are the loss of time and experiences. Many people living overseas live for the breaks. They live for spring break and for summer and for the holidays. And they've been stuck at home all this time, not being able to travel. I know that many of the students that are especially in 11th and 12th grade going to be taking their final educational trips overseas have had to have those canceled. I know of senior proms that have been canceled. The senior trips when they all take off after graduation or in their senior year without parents to countries around the world to hang out with their friends as their first step of independence. There can be a feared loss of time when school starts back up again. I've heard schools that have talked about running longer days or perhaps running the school year longer into the summer. And educators have been afraid. They work extraordinarily hard during the school year, and they really look forward to that time of regeneration during the summer, and to be worried that that's threatened. Or maybe the full summer time will be there, but there's also conversations about people needing to come back 14 days in advance to quarantine themselves to make sure that they're healthy before they can come back to school. And so that would in some way shorten it. There's been a loss of feeling, of a kind of sensory deprivation, having to wear masks over your face, going outside and not being able to breathe the air or feel the wind on your face. I've talked to educators who are so tired of communicating through technology. And I can only describe it as kind of a sensory deprivation where, yes, I can see you, but it's just somehow not felt in the same way as when I meet you downstairs at the corner of a street and I realize I can see you face to face. I had someone really describe that as feeling almost euphoric. And even though they were supposed to go inside, they took a few minutes to sit there and have that conversation. There can be a massive loss of independence, to go outside, to be able to go to friends' houses, because many people are only allowed to have residents in their buildings. In some buildings, people have to have passes to leave, and only one person can leave the apartment every 48 hours. So that loss of freedom, staying in somebody else's house. We're often walking around on eggshells trying to make sure we don't disturb the pattern of the person we're staying with. There can be a loss of energy. There's so much that has changed. Mark Zuckerberg and Steve Jobs, they wore the same clothes every day so that they didn't have to make a decision when they went to the closet. They saved that energy for their workspace. And educators have had to learn how to teach online, learn how to use new applications, for some like Seesaw, and learn how to assess children's learning, I've even heard of some educators that have had to change their entire pedagogy from the inquiry-based learning to more rote learning because the parents were not able to support the inquiry-based learning at home. And so just massive changes. And every time we have a change, it takes extra energy because our brain is trying to establish a pattern and understanding of what we're doing now. And so that loss of energy, a loss of certainty, the pace and sequence of life, the days of the week, the days of the weekend, morning, lunchtime, evening, the seasons of the year, all of those are ways that we mark time and have certainty and predictability. And right now, I think one of the biggest questions on all of our minds is when will it end? And that there's just no certainty. You know, there have been lots of estimates out there, but right now it certainly has surpassed some of the initial estimates on when it would end. And so then we move ideally at some place to reconstruction of equilibrium. And I think for most people, this is still out there in the distance. I realize we have people in lots of different situations. This reconstruction of an equilibrium of when the roller coaster finally becomes balanced. We're going to create a new normal. We won't go back to the way it was before. We'll create a new normal in terms of having learned things from this crisis, having changed. I said to a group of student life workers today at a university in Singapore, I'm waiting to see how everyone who's lived through this crisis, this pandemic, parents their children in the future. Like, are they going to be really strong about washing hands in a way that maybe the last generation was? But our goal in the reconstruction of equilibrium is post-traumatic growth. That means we wouldn't choose to go through this again. But as we allowed ourselves or helped ourselves to grow through it, that we realize we like who we are better now than who we were before. And maybe it's a refined set of what's important to us, a refined set of priorities. Maybe you'll even learn things in the online teaching at a distance that you'll carry back into the classroom. I really want to highlight the community aspect of this because I just went through kind of a natural response, but the reality is that each of us will show this response to each other, express this response in our own unique ways. And we can tend to judge each other when we're stressed out. We can decide that our way of coping is the right way and somebody else's is the wrong way. And unfortunately, those kind of judgments tug at the social fabric within organizations. I know that one of the things that couldn't come up, it certainly came up during SARS in Singapore 17 years ago, and that was the difference between the stayers, the people who stayed in Singapore, and the leavers, the people who went home. And we don't want to let those things tear at our social fabric. We want to recognize that for a million different little factors that each person picks their own way to cope and to live through a crisis. I also want to highlight that we can have physical reactions to trauma. And the reactions that you see here listed are very characteristic and distinguishable within a time-limited crisis, like an earthquake. They're not quite as clear in this kind of slow-rolling, slowly building crisis that we have, but certainly this idea of kind of disorientation and numbness. I know that at times I've found myself walking around thinking, oh my gosh, what am I thinking? And what am I supposed to be doing next? And so that disorientation is there in a more subtle way, instead of the kind of frozen, my feet are stuck in cement that might happen. We can also have a fight and flight reaction. While the old brain is saying safe, not safe, it starts to prepare itself to respond if it thinks that something is not safe. And right now, we have something that's not safe, and it's going on for a very long time, and it's spreading and growing in lots of different places. And in this case, we may not have the giant adrenaline and heart racing that we have when we need to respond within seconds. But I think that many people can feel this kind of nervous energy, this hyper vigilance, a more aware of watching what's going on, and that there may be a nauseousness that's there, or not being able to eat as much, and that's a natural part of it, because our body says, I need my muscles ready to work. I don't need to be spending energy on what's in my stomach or in my body. And so that nauseousness can be there. And we can experience sensorial sensitivity, where we're noticing, oh, the smell of hand sanitizer, boy, some of it I think is really awful. And that could serve as a trigger in the future when I smell it again to things that scared me in the past. But also I talked about this sensitivity that's kind of a dullness that's happening from being behind masks or being behind screens and cameras. And often when we're dealing with something that feels unsafe, we may stay up many hours. We're trying to ameliorate it. We're trying to make it better and fix it. But at a certain point, we'll just stop from exhaustion. We won't be able to continue on. And in this crisis, I think we can take that in hand and recognize we really need to get sleep, because in many ways, this crisis is not a sprint. It's a marathon going on much longer than most of us ever expected. We can have some behavioral reactions. We can have, you know, this ongoing anxiety. In fact, a trauma reaction is an anxiety reaction. Sleep disturbances, where we're sleeping extra or we're not sleeping enough. Some people particularly find that they can go to sleep, but they can't stay asleep. They can't get a full night's sleep. There may be difficulty in concentrating, intrusive thoughts, you know, where we're trying to focus on running a class, and then all of a sudden we're worrying about a loved one back in our home country where things seem to be ramping up right now. Having a startle reaction, being more easily startled, hypervigilance in watching our community, irritability, and we may also isolate ourselves. Often when we have difficult emotions, we don't feel as ready to be out with other people, and so we may isolate ourselves. So we often can have long-term reactions to crisis, and I think in many ways we're not anywhere near to that long-term crisis phase, because often this happens months or years after a crisis is over, and often recovery. But I think in this one, it's important to think about the waves that can happen. And I've talked about the waves in terms of how all of us find out about this crisis at a different time or in a different way. But there's going to be some crises or waves of this crisis that come in the future. For some people, it may be when they return to the country that they're teaching. So some of you are in Australia and some of you are in the United States and the UK, and you're going to have to return to the country where you're teaching. And I've heard some educators talk about, you know, fear in doing that, not wanting to also be confronted with a 14-day quarantine when they show back up in the country. And so that may be a wave. People have talked about being out of their homes for 2 months and their IEs not being able to, or housekeepers being there to clean. And so a lot of our homes here don't have the same protection of dust and particles coming in. And so they're really anxious about getting back home and having to get ready to teach again and to clean up their place. And even returning to school. And one of the waves I think for some people in schools are going to be that some students don't return. Maybe some educators don't even return. And there's going to be the gap in the loss of people that they were used to seeing. The truth is, we also can have secondary injuries. And those secondary injuries can be experienced as feeling worse than the initial crisis itself, in that we turn to people, we expect them to help us, to give us good information, to be supportive and understanding, to give us good medical or mental health care, to be compassionate about our work situation, or to not fill us with spiritual platitudes. And yet sometimes we run into insensitive care. And for many people, they feel like that secondary injury is worse than the first. So some of you may have experienced some of these crisis reactions that I've just talked about. Some of you may just be starting to experience them. Some of you may be moving into more of the longer term reactions, depending on where you're living. And you may, as I said, continue to experience them in waves. We are by nature resilient, and we are primarily people who are going to return to some kind of equilibrium. And we can return to some kind of equilibrium during a long-term event like this. And certainly we're going to look forward to doing that at the end. And so I want to talk about some of those ways that we can do that. But first, I want you to just imagine this glass of water, you know, and you probably thought that I'm asking, it's not half full. So you might not have thought that I'm going to ask if it's half full or half empty, but it's about 6-8 ounces of water that are in here. And my holding it right now isn't hard, but if I tried to hold it for the next hour, my arm would start to ache. And if I tried to hold it for a whole day, my arm would maybe be frozen in this position and I would need physical rehabilitation to use it again. The weight of the water hasn't changed. It's remained the same, but its impact on me has changed over time. And that's the way stress is. If we don't address it, it can be the same amount of stress, but can have greater and greater impact. I just want to highlight some of the unhelpful coping strategies. They might be avoidance, substance use, risk-taking behavior in light of the cautions that we're getting. There may be numbing out, numbing out such as the mother of all Netflix binges. And I mentioned Netflix binges humorously, but in my counseling office, it is the most significant trend I've seen affect all generations of people. We may also lash out emotionally at those who are around us. We want to look for helpful coping, acknowledging the stress, but doing that in moderation. We can't take it on all at once. Asking for help, problem solving, and strengthening our resilience. Resilience is not a characteristic that we just have or don't have. It's about bouncing back when things are tough. It's not being a victim, but surviving and thriving, or growing stronger through difficult times. And as I said, it's a capacity that we can foster, that we can learn, and that we can grow, and it can be a lifestyle. And I want to share with you, as Roger mentioned, I led a crisis response team a couple of times to the Jakarta Intercultural School as they went through a crisis that started in March, April of 2014, and continued to get worse over the next definitely 6 to 9 months, and didn't resolve for a couple of years. And when we took the second crisis response team in September of 2014, we talked with them about these characteristics of resilience, and it made a huge difference for many educators over the long run. And I've had people come and tell me that educators from Jakarta have taught them these 8 areas of resilience because it did make a difference in getting through that difficult time. And so I just want to bring to you what some school counselors and myself pulled together to support those educators. We look at physical abilities, and as we look at physical abilities, right now we're under a lot of stress, and that stress can wear our body down. This crisis is a marathon, and sometimes we can forget the basics of taking care of ourselves. I'm not going to go through all of these things. In some ways, there's no surprises there. I think the focus I want to add is that when we talk about taking short breaks, because sometimes it seems too hard to take a long break, especially from screens. If you can do anything to just take a 5-minute break occasionally from screens, because I've heard of people who are on most of the day as they're trying to manage their personal and their professional lives. And I think the other thing that we want to focus on is these healthy ways of being that strengthen our immunity. My sister is a TCM practitioner, traditional Chinese medicine, and she's reminding me that, you know, our cells' ability to manage viruses and other things, or immunity functions, go down when we eat sugar. She says the cells are paralyzed. We can overtrain, and overtraining, so doing too much exercise, has been shown for 72 hours to reduce immunity. So as we look at all these things we know so much about, we really want to look at them with a new lens in terms of how they can help us in our immunity. We want to look at our emotional capacities, identify what we're feeling. That simple act of naming what's going on in our old brain, I'm feeling scared, I'm feeling upset, actually moves our functioning to our new brain, to our cortex and neocortex, and gives us access to problem solving and to analyzing and being able to make better decisions. We want to name our feelings, like the nervousness that we're feeling. I've decided that I've named my nervousness the pandemic onset of ADHD, and that's my own personal diagnosis. You may have one of your own. We want to express those feelings through talking, but also maybe journaling, maybe movement, maybe even dance, you know, or physical activities where we're able to. We want to take a balance between not letting our emotions invade every aspect of our lives. And many people going through crisis find it helpful to compartmentalize. And that means, okay, I'm going to think about my emotional reactions at this set time for this time period each day, or a couple of times a day. But we want to make sure we're not stuffing. And stuffing feels like taking a beach ball and trying to hold that beach ball underneath the water with one hand. It's a very hard thing to do. And when we get distracted, that beach ball, or the emotions that we've been trying to hold down, are going to pop out. We want to allow ourselves tears and laughter. These are on opposite ends of the spectrum, but both of them get our lungs moving. They take away, tears can take away chemicals that build up in our bodies in times of stress. Laughter can bring on endorphins that help us to feel healthier, and can actually even help with our immunity. And so we might want to think about, how do we allow ourselves tears? I recommend an angst playlist on iTunes or Spotify, those surefire songs that let you release those tears that you might have been holding back at a safe time and place. For laughter, if you dare, to Google COVID-19 memes. There's an enormous amount of humor out there, and there's also some really, really touching videos. And one I saw that really stands with me was this middle-aged man with a mask and jacket. He looks like he's in Asia, gets out of a car to greet 4 other men. And one of the men that was standing outside the car reached to shake hands, and the guy jumps back like this, and then he proceeded to tap the inside of both of his feet against the inside of each other man's feet. So 8 taps all together for this group of hellos. And I was just touched with how much we still want connection, and that we can get creative and find it in unique ways. Fear is a big part of our emotions to crisis. And the fact is that we can take this opportunity to grow our capacity to manage fear. Do something every day, some little thing that we fear, and find out how bold, how brave, how absolutely capable we can be. I'm going to look at our cognitive abilities. Crisis, the very definition of crisis is chaos. And chaos means that things aren't going according to habit and plan. And when things don't go to habit or routine, we have to make a lot more decisions, and we can end up with that decision fatigue. And so maybe there's ways that you can simplify. Maybe there's extra things that normally you would do, but that just aren't that important, and you can drop those by the wayside. You can create new routines. I'm almost thinking of it like, as international educators, many of us had to move to new cities or new countries, and we all know what it's like to create new routines and to go through the shock of those new routines, and then to finally settle into a comfortable new pace of things. You know, maybe we need to do that in this situation as we're having to create new routines. We have a lot of skills of adjusting and coping. And maybe we haven't thought about how moving to another country and the skills of doing that can be harnessed to be successful in coping with this pandemic. We have a tendency as human beings to catastrophize. I like to say that evolutionarily, all the happy people got eaten, because when we are out there looking for danger, we can get to safety. But if we're walking through the woods or the forest, we're going to get eaten if we're not paying attention. But that means that even now we don't have to protect ourselves against wild animals, we still have that same response. And so in a crisis, that can get very quickly triggered where we are worrying. And what we want to do is convert that worrying to worrying well. So we start to worry about something, and we want to ask ourselves the question, do I have control over this, or do I not have control? If I have control, then I want to use that worrying energy to do something about fixing that problem. And if I'm worrying about something I have no control over, then I need to let go of that. And as an antidote to always looking for danger, we want to try and look for the positive, to look for the good. That's not to deny the difficulty that we're going through, but our natural tendency can be to filter out the positives, to filter out the things that are good right now. And so to take the extra energy to recognize what those are can help to also reduce our worrying. And we might want to limit our media exposure, the number of stories that we read, and to pick a couple of reliable sources and to compartmentalize when we're looking at those. I was just reading another study today that was saying that people who check data and read stories tend to be more anxious. Now, we don't know whether they were that way before, or reading all that data is contributing to the anxiousness, but there's a correlation, not necessarily causation. But the fact is that limiting our media exposure and maybe taking that extra time to do things that soothe us and calm us might help us get through this marathon. Education and experience. You know, are we learning things about ourselves, about others? I imagine that there may be some of you that have had thoughts that start with, I never thought I could. I never thought I could teach classes this much online. I never thought that I could live with my family members this well and in the house for days on end. And are you realizing your own capacities? Are you learning maybe some of your limitations? Because we all have limitations, and to try and adapt to those limitations. Another way that we can learn from this is we can become an expert on this crisis. I know I've just said avoid media, but there are reliable sources for those of you that, you know, teach TOK, Theory of Knowledge, and other courses. We're teaching the students reliable sources. There's amazing questions out there that we can start to answer that might reduce our feelings of helplessness, like what are people's reactions to crisis? What's the impact of confinement? One of the things I want to know is, do mirroring neurons, those neurons that help us feel what somebody else is feeling, do they work as well through this video link up as they do when I'm sitting with you person to person? how do they sequence genomes so that they can figure out exactly kind of use genomes to contact trace and to find out who somebody got the virus from, which is something that has happened here in Singapore. So that information can actually also be a source of our own power in reducing our helplessness. And then just the simple question is, do we have some extra time? I've heard both. I've heard some people who have said, I have absolutely no extra time, and I don't want to minimize how hard you're working. At the same time, I've heard other people say, I do have extra time and I don't want to waste this opportunity. And so they've gone about learning a new language through an online course, or learning something that helps them advance and grow and not feel like this time has been just about waiting for it to be over. Researchers have shown us that social support, again, is as important as food, shelter, and water. And that when we lack social connection, that we can feel it in our pain neural network. And when we have social connection, that we can feel it in our pleasure neural network. And so we want to make sure that we don't lean towards isolation because we're having difficult experiences or emotions, but that we step out and we connect with people. Connecting with friends or connecting with a counselor to help clarify, to get feedback, to help us get a new perspective. Brené Brown reminds us that sharing our vulnerabilities is actually an act of courage, but that when we don't share our vulnerabilities, we often do that because we're afraid that we're the only one. We're the only one feeling so bad. We're the only one having these crazy thoughts. And when we feel like we're the only one, there can be an accompanying feeling of shame. And so sharing and talking to other people can help us to reduce those mounting. You can see how they really add up the more we hold things in and don't share them with other people. And I realize some people are introverts and some people are extreme extroverts. We're going to have to decide what the level of social support is right for us. We also want to ask for help. And over, the first reaction, have you asked anybody to help you? I don't want to be a burden. But in fact, there's this thing called the helper's high. And that is that when people are able to help somebody, they get a real increase in positive feelings. So in fact, we're not burdening people. We are actually withholding a positive opportunity from other people when we don't ask them for help. We're keeping those opportunities away from them. So think about what you can do in asking other people to help you. Self-esteem is about our value, and we want to look at valuing ourselves. We want to think about situations in which we have value. So do things that you like to do and things that other people recognize that you're good at. Ideally, you have some people in your lives that when you get done spending time with them, you feel stronger, you feel more capable and more creative and more intelligent. Make sure that you find time to be with them. Be proud of your successes and celebrate them. Right now, we're all living through something we just could never imagine that would happen. That's successful. For many of us internationally, we live to travel. And that's a great place where we make memories. And I just encourage you to figure out how to make memories at home. One of the suggestions that I heard that I really liked was having a camping trip and doing it under the dining room table with a sheet that covers it. So make memories even as you're having to stay at home. And spirituality is a source for many people that search for an unquantifiable spirit that nourishes us and brings us joy. And some people find that through organized religion, though that is really difficult at this time. with so many places, houses of worship having been closed. And some people don't find it through organized religion. They might find it through a practice of gratitude, through spiritual readings, through looking at how their spirituality helps us to understand the meaning of hard times, or through the stress reduction of prayer and meditation. The one thing I would stress is for you to choose what spirituality works for you. We've learned in working with people in crisis that what one person imposes on another is usually not what's helpful. It's what the individual chooses for themselves as a spiritual practice that's helpful. I've offered a lot of ideas in this talk. I hope that there's some that you are already doing, and well done for that. There may be some that you've forgotten that you want to reinitiate. I hope there's some new ideas that you might have found helpful. The truth is that we're all unique and individuals, and what works for one person may not work for another person. And so you want to ask yourselves, what helps you to rejuvenate? What gives you more energy? What helps you to feel joy? And what helps you to be the best version of yourself? And develop a plan. Don't take on too much, just a little bit. Every little bit actually that we do to help ourselves seems to have an exponential impact. And to remember that we're looking for progress, not perfection. We've provided some additional resources for you here. Some of these are from the CDC. Some of these are on a website that I maintain. I know that NOVA is going to be having some resources on their website that are going to be coming out very soon. There's information on coping with anxiety and helping kids to feel stable. The National Association of School Psychologists has materials, and some of their materials are translated. The International Association of School Counselors has pretty significant and growing lists of articles and websites that can be helpful as for students in the school setting, but also just for you as individual. Consider what resources and support are offered by your school or counselors that may be available in your community. There's also support available online through therapists that are available remotely. And there is a directory, you've got a website address there for therapists specifically familiar with working with expatriates and third culture kids and families. For those of you that are in your home country still, before coming back to where you're teaching, there are crisis text lines that are available. I did try these, the one for the United States with my virtual phone number here from Singapore, and it didn't work. You might want to try yours, but these may be limited to people in their home country. And certainly, as Roger mentioned, there's contact information for both NOVA, who has hosted and supported these webinars and to whom I'm very grateful. And I'm happy for you to contact me as well. I want to leave you with the thoughts of psychiatrist and neurologist Viktor Frankl, who survived 3 concentration camps in the Holocaust. And he went on to teach many people these concepts. But in his own words, everything can be taken from a man but one thing, the last of his human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way. And our hope today is that the ideas that we've offered can help you in some way find a resilient way through these tough times, these difficult times. And with that, I want to thank you for joining us today. Please let us know how we can continue to support you, and I'll turn it back over to Roger.